Hip joint is the body's second largest weight-bearing joint that allows mobility of limbs. The rounded head of the femur, also called thigh bone, forms the ball which fits into the acetabulum, a cup-shaped socket in the pelvis. Both the bones of hip joint are held in stable position with the help of muscles and ligaments. Minerals and nutritional supplements are essential for bone growth and its maintenance, which is supplied by 3 major blood vessels through small capillaries to the hip joint. Damage to this blood supply causes bone death, resulting into avascular necrosis. Avascular necrosis, also called AVN, literally means bone death. As avascular necrosis progresses, bones and surrounding joint collapse, and pain increases, limiting patient's normal range of motion and thus affecting the normal life. As this disease frequently occurs in younger patients, total joint replacement is not the recommended treatment. Ossron is autologous bone implantation treatment for bone defects. It enables effective regeneration of damaged bone and provides numerous advantages for the patient like shorter surgery time, relief from pain, considerable restoration of range of motion and active normal life. Ossron is also indicated for the non-union bone fracture, congenital bone defects, maxillary and mandible bone defects. The Ossron process begins with medical assessment of the patient. As a preliminary step, a thorough diagnosis via X-ray is done to inspect the bone condition and determine the extent of defect. Once the patient opts for the autologous bone implantation procedure, the patient is admitted to the hospital. After administration of local anesthesia, few drops of patient bone marrow is harvested from the iliac crest. Collected bone marrow sample is transferred in specially designed sterile biopsy kit and securely transported to RMS Regrowth Cell Processing Center located at Lonavala at temperature-controlled conditions for culture. From the moment the patient's biopsy arrives at the Regrowth Cell Processing Center, it is subjected to proprietary methods and assays to test and verify both safety and quality. Every step performed at Regrowth's GMP and GCP certified laboratory is in accordance with established high-quality standard procedures. In the laboratory, the osteoblast-producing cells are released from the bone marrow. The released cells are cultivated and introduced to a proprietary osteoblast expansion process. Within 4 weeks, the appropriate numbers of cells are obtained. The cells are evaluated for their bone-producing capacity. The cultured cells are then securely transferred to the hospital for implantation. Once the implant kit reaches the hospital, the patient is admitted on the same day of the scheduled date of implantation. Ossron implantation is performed via minimally invasive surgical procedure. First, the surgeon identifies the defect and prepares defective area for implant. Once the implant is successfully injected, it will ultimately result in the formation of new 3-dimensional bone at the defect site within a few months. Rehabilitation is a crucial part of the recovery process. Post-operative mobility is encouraged in order to maximize the bone formation. Rehabilitation is performed under strict guidance of the physician and physical therapist. Ossron treatment is available to patients with cost benefits through medical insurance, both reimbursement and cashless procedure. For any further